Hello and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. I'm your host, Jason Howland, and as spring arrives and snow melts away, the grass starts growing, the trees begin budding, and pollen is produced. And with that, pollen causes a lot of people problems in the spring. Here to talk more about seasonal allergies is Dr. Barry Alper. He's a board-certified allergist who sees patients at Fairmont Medical Center. Thanks for joining us today on Speaking of Health.
Glad to be here, Jason.
Well, seasonal allergies, I'm assuming, are just what the name implies. They are associated with the seasons. First of all, what are the different seasonal allergies and what causes them?
Well, seasonal allergies are respiratory tract problems predominantly, and they're often referred to as hay fever. The symptoms we see in the classic cases of seasonal allergy are predominantly respiratory. They include things like itchy, watery eyes, nasal congestion, sneezing, runny nose, itchy throat. The triggers for these sort of things are the different pollens. Trees and grasses pollinate at different times of the year. The trees initially early in April, or at least before global warming, and now we even see some of them in late March. And the first tree in Minnesota we usually see pollinating is the maple, and that's followed by birch and elm and cottonwood. And the tree pollen season for each individual tree may run only a week or two, but cumulatively, because the trees sort of march on their pollen seasons, the season can really run up to 2 months from the end of March into May. Then in May and June through the summer, the grasses pollinate. And then at the end of the year, we have ragweed, which really causes a great deal of problems. And in Minnesota, ragweed season usually correlates with state fair. And so that's the march of the different pollens.
So right around August, late August?
Late August, September, and then the season usually ends with the first hard freeze, the end of September, beginning of October.
So first of all, with spring allergies in trees, is it when the trees begin budding or the leaves have already grown, or when?
It's really the pollens vary, and they do come when the trees bud. And pollen is a very light substance, it's invisible, and it just blows for miles and miles. So you don't have to have a particular tree in your backyard to be affected by that tree. Or in order to improve, if you are allergic to maple or birch tree, it doesn't really pay to cut down the tree in your backyard because you really may have symptoms from a tree miles and miles away.
Well, this spring in particular, it seems like more people are suffering from allergies and the symptoms are more severe. Is there a reason for that?
Well, I think the pollen counts have been particularly high this year for a number of reasons. I think one was that we had a relatively mild winter, and so there was not, so things were set to change. And then spring came on quickly, and it was relatively dry with a lot of snow, so things all of a sudden started to pollinate very fast, and the counts went high. We did not have a great deal of rain, and rain tends to be protective because it washes the pollen out of the air. So a rainy spring may allow things to grow more, but the pollen counts go down with every big rain.
What exactly is pollen? What does it look like? How big is it? What is it? You said it flies around in the air. What does it do?
Well, pollen is responsible. It's the seed of the tree. It allows the tree or grass or weed to reproduce. Mm-hmm. And so the different pollens have different forms, and they're microscopic. I mean, they're microns. I mean, they're as thin as an individual hair. What's interesting is that some people, I know when I first went into practice, and I still see this now, is people would often complain they were allergic to the cottonwood tree. Because late in May, we often see cotton flying from the trees. And they would presume that was the pollen, but it's not. And most people who see the cotton and say they get sick from cotton are really getting sick from grass pollen, which pollinates at the same time and is invisible, but people see the cotton and assume they're allergic to the cottonwood tree.
So the pollen is invisible to the human eye. It flies around and then it lands
deposits in the mucous membranes and then causes reactions.
So what is it about pollen? Why are so many people allergic to it?
Well, that's a pretty good question, Jason. I don't really have the answer to it. I mean, it's unknown why people have an allergic system. Okay, our immune system's important to protect us against infection from viruses, from bacteria. But allergy is not protecting us against anything because pollen is basically harmless. And so people who are not allergic to pollen don't react, and people who are allergic to pollen do react. And why that system developed is not entirely clear.
So your body is fighting the pollen even though it doesn't have to?
That's exactly right. And it seems as if the allergic system developed initially, if you look at it over time, as a protection against parasitic infections. But it's been maintained in certain portions of the population, and it does cause negative consequences to those people who are allergic. So a person who's allergic to ragweed, for instance, can get very sick with hay fever, upper respiratory tract symptoms, or asthma during the ragweed season, yet there's really no benefit for that individual. So why that occurs is not entirely clear, Jason.
So how does someone, other than the obvious, they have an allergic reaction, but how does someone know what they are allergic to, and then when should they come in to see you, an allergist, and get tested?
Well, I think that the diagnosis of allergy is important if it has a significant consequence for the individual. And so it's not, hay fever, allergic rhinitis, pollen allergies during the spring are not life-threatening, but they do affect quality of life. So if an individual feels like their allergies interfere with their sleep, interfere with their job performance, they need to come up with a treatment plan. In order to optimize a treatment plan, it's important to know what you're allergic to and what medications are available to treat particular symptoms. And that's where an allergist plays a role. So the way we can diagnose specific allergies is by skin testing or by blood testing. So we can test individuals to see what trees they're allergic to, what grasses they're allergic to, what weeds they're allergic to, or if they're not allergic to pollen and having symptoms, perhaps they're allergic to molds, dust, or animals. So these things can be skin tested and diagnosed.
And how does a skin test work?
A skin test works by introducing a small amount of the antigen in question, the pollen, mold, etc., in question onto the skin and waiting for a reaction. It's a safe test. The reaction is limited. It's usually a welt, maybe a quarter, maybe 50-cent size, and that will tell us whether or not somebody has an allergy to that substance. It's a very reliable test. It's accurate, and it's easy to do. Blood tests can also provide answers on what patients are allergic to, so we can run a blood specimen as well and find out if somebody's allergic to a particular antigen.
Can you be allergic to more than one?
Many people, it's interesting, many people have one allergy and other people, will have 10 allergies to different trees or grasses. What's also interesting to me is that positive reactions alone are not necessarily significant. So I often see patients allergic to a tree or a grass and be asymptomatic around that tree or grass. So more than the presence of allergic antibody is necessary to produce symptoms. And so at the same time that you're doing skin testing, that's not enough. So running a blood test, running a battery of skin tests is not enough to make the diagnosis and develop a treatment plan. You have to really correlate that with the history.
You talked about treatment. I'm assuming the first step in treatment is medication. There's got to be billions of dollars made in over-the-counter medications for allergic symptoms. What are some of the medications folks should be thinking about taking when they have seasonal allergies? There
are some very, very good over-the-counter medications available. So antihistamines have been utilized for 30, 40 years in treating allergy. The initial sets of antihistamines were things like Benadryl or chlorpheniramine, and those medications are effective but have the side effect of drowsiness. The newer generation of antihistamines cause much less drowsiness. They last for longer periods of time. They can last up to 24 hours. And so they're reasonably effective medications. A certain population of people with allergy, however, will not respond to antihistamines. And so that's where we can utilize some of the other classes that are available. And they include, they include things like nasal steroids, different ophthalmic drops, and other topical medications.
And I'm assuming with seasonal allergies, probably the best medicine is just to stay away from the pollen, but that's not really possible when you live here in the Midwest, is it? But there's probably some things you can do.
Well, avoidance is a very effective treatment. However, like you pointed out, it's really difficult because there's so much pollen. Our pollen seasons are short, so they're very hectic, so the levels go up really high. But there are some things that can be useful. I think it's really important with children who play outside a lot to make certain that they take a shower at night, because you want to wash the pollen off of their hair, make sure they change their clothes, because you don't want them to lie down in bed in the same t-shirt they were rolling around in the grass in, because that certainly will make a difference. Air conditioning is somewhat beneficial, but certainly in the spring that's not going to make a major difference. And then structuring things, I think, is really important. People who have really severe problems, and I say this particularly during the ragweed season when patients get particularly sick, but is viable for the spring as well. I mean, you don't want to go on a camping trip over Memorial Day weekend if you're allergic to grass pollen, because Memorial Day weekend is when the grass pollen starts to peak, or during the ragweed season it's Labor Day weekend. So you want to really structure things. You'd be better off going to the mall than up to the state park or playing around a golf. You know, in those patients where avoidance measures aren't effective or medications aren't enough, there are some other things that we can do. I mean, immunotherapy is a very effective treatment option.
And you're talking allergy shots, can they cure people of allergies?
Well, I think they can have a very positive effect and have a long-term effect. And so in that sense, they can be curative. They're not always curative. About 80% of patients respond well to immunotherapy for pollen allergy. And a 3-year course of treatment in many of those patients will result in a long-term benefit.
And that's pretty good results.
I think it's excellent results, especially when you realize that we don't put every patient on shots. We pre-select those patients who are doing the worst. And so patients who respond well to an over-the-counter medicine really are not candidates for allergy shots. Those patients who are doing poorly on multiple medications certainly are the sort of individuals we want to focus on putting on immunotherapy.
All right. Well, it is a timely topic with this time of year, but unfortunately, we're all out of time, Dr. Alper.
Well, it was a pleasure talking to you about this, Jason.
It was. Thank you for joining us today. And the phone number to schedule an appointment with allergist Dr. Barry Alper at Fairmont Medical Center is 507-238-8547. That's all the time we have. Have a great day and be healthy.